My name is Emily Rohan. I'm a registered nurse at the North Alabama Crisis Center. I am also in the BSN program at Athens State, and you're here for my STI awareness and prevention presentation. Thank you so much for joining us. First, I'm going to pass out the STI overview, what we're going to go over today. So if you would take one and pass one down. I just want to let you guys know again that we are recording this presentation. Everyone's okay with that? Okay. So the first handout I just handed out was the CDC STI overview, and the second one is a flyer on where you can get free STD testing. So if you want to take one down and pass them around. And the third one is a presenter evaluation form, which I will have you fill out after my presentation. And you can put one down. So my main goal in this presentation is to increase awareness, STI awareness, to prevent STIs and encourage regular testing. And my presentation objectives are to be able, for you guys to be able to explain the differences between viral and bacterial infections, and to also identify the most 3 common types of STIs and their symptoms, and why regular testing is important in the long-term reproductive health. So first I'm going to go over a history of STIs. They have been traced back to ancient civilizations such as ancient Egypt, Rome, and Greece. So they're not new, they've been around for a long time. I'm going to throw in some fun facts for you guys. So my first fun fact is that the use of merkins, also known as pubic wigs, can be traced back to the 1450s in Europe when they were experiencing a syphilis outbreak. So mainly the prostitutes would use it to cover up their sores, lesions, so they can keep working.
Where would they get the hair to make those wigs?
Usually from like hair donations or their own hair.
Interesting.
So viral versus bacterial. So the main difference between viral and bacterial infections lies in the type of microorganism that causes the infection, as well as how they're treated and behave in the body. So what I want you guys to take home with this is the main thing to remember for viral and bacterial is the treatment. So if you have a viral infection, you can't treat it with antibiotics. So antibiotics aren't going to fix everything. So our first STI is chlamydia. So this is the most common STI in the United States. It's easily transmitted through oral, vaginal, and anal sexual contact. Women are more affected than men, and it's often asymptomatic.
You said oral, so what are you can get it in your mouth?
What, like, is it bumps?
It's not bumps, it's more, there's more symptoms rather than signs. So I'm gonna go over the symptoms right now. For women, it's abnormal vaginal discharge, pain and burning during urination, pain during sex, lower abdominal pain, and bleeding between periods or after sex. So for men, you're gonna have urethral discharge, dysuria, which means pain during urination, and pain or swelling to one or both testicles. So, like I said, this is the most common STI in the United States, and the treatment is going to be doxycycline, which is an antibiotic. It's 100 milligrams by mouth twice a day for 7 days. So our next one is gonorrhea, commonly known as the clap. Rates of gonorrhea are higher in men and often asymptomatic as well, meaning there's no signs. Signs for men: painful urination, discharge from the penis, usually yellow, white, or green, swelling or pain in one or more testicles.
You know why it's called the clap?
Where
Oh.
yes, my fun fact is why it's called the clap. So, fun fact: in the past, people would clap the sides of the affected area to relieve symptoms. I'm gonna assume that was for the men.
Oh.
So another rumor is that they would get two bricks and clap them together with the penis and to get the secretions out.
Oh.
Obviously, it's not a realistic method of treating an STI.
Yeah, that's like.
Beat it out of them.
So treatment is an antibiotic injectable, 500 milligrams, and that's a single one dose. So that's another fun fact, I guess. You don't have to take pills for a week.
Yay.
So our next one is called trichomonosis, commonly known as trick. It's a parasitic infection. Infections are limited to the vagina and the penis. Many are asymptomatic. Men are more likely than women to be asymptomatic. So signs and symptoms in women are vaginal discharge, itching and irritation, painful urination, pain during sex and or after, and inflammation. Signs and symptoms for men are discharge from the penis, painful urination, itching and urination, irritation, and painful during ejaculation. So treatment is called Flagyl. It's a by-mouth pill that you're gonna take twice a day for 7 days. So fun fact with Flagyl, you cannot have alcohol for 36 hours before you start and 36 hours after you finish. And obviously no alcohol during the treatment. So next we have bacterial vaginosis. It's a common vaginal infection caused by an imbalance of naturally occurring bacteria in the vagina. Signs and symptoms: a thin grayish white vaginal discharge, a strong fishy odor, especially after sex, vaginal itching, and burning. So treatments is antibiotics, typically oral or topical. Usually they're gonna prescribe you clindamycin.
Does that one go away on its own?
No, it does not. You have to get it treated.
What does it mean by tropical?
Topical means on the skin, like a cream. Okay, so next we have herpes simplex virus. So there's herpes simplex virus 1 and there's 2. So 1 meaning the mouth and 2 meaning down below on the penis or vagina or around the anus. Signs and symptoms are both the same for male and female. They're going to be painful blisters, itching, tingling, or burning, painful urination, flu-like symptoms. That's for HSV2. And for one, cold sores or fever blisters sometimes are triggered by extreme heat waves, tingling, itching, and also painful blisters.
And this one, there's no cure.
This one, there is no cure. My fun facts. My fun fact is there's no treatment or cure available currently, and there are antiviral medications, suppressive therapy, topical treatments, and pain relief. So next we have human papillomavirus, also known as HPV. It's the most common STD worldwide. Most are self-limiting, spread through intimate skin-to-skin contact. Types are separated as oncogenic and non-oncogenic. So signs and symptoms, some strands will give you genital warts. Those are low-risk types. Cervical, penile, anal, and other cancers, those are more high-risk types. Respiratory papillomatosis, which is rare, and most HPV infections are asymptomatic, which means they have no symptoms. So fun fact, nearly everyone in the United States will at some point get HPV in their lifetime, and that is per CDC guidelines.
That is not so much of a fun fact.
No, it's not a fun fact. None of these are fun facts, but they're interesting facts.
How will almost everybody get HPV?
That's just their statistics.
Because it's so widespread.
Yeah. So next we have human immunodeficiency virus, also known as HPV, is spread through bodily fluids containing HIV. Most common transmission is through sexual contact. So signs and symptoms, we have the chronic HIV, which is the latency stage. No symptoms or mild symptoms like swollen lymph nodes. We have the second acute HIV infection, which is usually noticed about 2 to 4 weeks after infection, which includes fever, fatigue, swollen lymph nodes, sore throat, rash, headache, muscle joint aches, night sweats, diarrhea, and mouth ulcers. And then we have the final stage, which is AIDS. That includes rapid weight loss, severe infections, chronic diarrhea, extreme fatigue, sores in the mouth or genitals, memory loss, depression, and night sweats. So, fun fact, people with HIV who stick to their treatment regimen can live as long as people without HIV with our modern technology.
Hopefully they can do that for herpes. Not that it kills you.
If they don't get treatment, like how long will they live? Like,
Depending on their lifestyle, it just depends on what they're doing with their life and how they take care of themselves.
How healthy they could.
Is there now a treatment for AIDS?
It's not a treatment, it's more, well, I guess it is a treatment, but it's not a cure. So it's gonna suppress the HIV to numbers that cannot be detectable. And so if you are on this treatment and you're with a partner, their chances of getting it is very low, but you have to be on the regimen like continuously.
And so like there's no cure for
There's no
it?
cure, no. You'll always have it, just depends on how you treat it or how you take care of yourself. And if you stick with your regimen. Okay, so, anyone know how we prevent STIs? Yes.
No sex.
Correct.
abstinence?
Yes.
Well, yes, that is the number one. You get a treat. That is the number one prevention and the only 100% guarantee. Anything else?
For like, protection?
What kind?
Like condoms or birth control?
Yes. Well, birth control, no. Condoms, yes. So I have a couple samples for you guys to look at. So first we have the male condom, if you want to pass it around. And then we have the female condom.
What? How does that even
I've
work?
never seen one of these.
They're
Oh wow.
What?
I've seen it
You've seen one before.
on the internet.
and then we also have what they call dental dams, which are barrier methods during vaginal, anal, or oral sex. So if you want, you can open them and look at them.
I do want to see one.
Is it flavored?
That one is flavored.
Flavored.
Flavored? Like they
Wow.
put this in their mouth?
From what I hear.
You want to?
Oh.
Don't we have a banana?
Oh, no.
Someone has to lick it.
What flavor is that? Banana?
These were provided by
It doesn't say
Thrive.
anything.
They're what?
These were provided by Thrive,
Okay.
which is the HIV helpline here in Huntsville. So they will provide treatment and prophylaxis.
I want to see it. I've never seen one before.
Okay, so why is prevention and early treatment? Why does early prevention and early treatment matter? So some STIs can cause infertility. So if you plan on having children later in life, if you don't get this treated, it can affect that. Chronic pain some do cause organ damage, and some do also cause cancer. So whether you like it or not, it is very important to identify something if you do have it. Yes.
Like cervical cancer?
Yes. Mainly from HPV. If you do come across HPV, you are more at risk for other STIs as well.
So I've always heard that syphilis non-treated can cause a woman to go crazy. Is that true?
I'm pretty sure that is probably yes, and they eventually will die.
Yes.
Mm-hmm.
Really? Wow.
So another rumor, Christopher Columbus brought syphilis over to the United States when they,
He's so great.
yeah.
Yay.
Okay, so any more questions?
Well, I don't know if you already answered this, but like, how does it make them go crazy? Like, how?
Because
is
it's a
it-
viral infection and it attacks your nerves.
Oh, your nerves. I didn't know if it was like because of like their like, just like all the symptoms or signs.
I mean, that could
make them.
cause
would
it
make
do.
them go
Yeah,
crazy.
it
makes
can
them
cause
feel
someone to go
certain ways.
crazy as well.
Is there a cure or treatment for syphilis?
Yes. So that was the,
First one.
I believe that is the Flagyl, and that's 2 pills a day,
7.
for 7 days. Yeah. So that one's treatable. The ones that we went over that aren't treatable are HPV, herpes, and HIV.
What about genital warts?
So genital warts would fall under the category of HPV.
Oh.
So they're not curable, they're treatable. You can get them frozen off. They can and they will come back eventually. Yeah. All right, and that's it. And I would like to thank you guys for joining my presentation. You guys were a great audience. I have provided my work phone number, my email address, and also we do have an Instagram that will maybe answer some questions that you didn't think of today. And also, if you can fill out the presentation evaluation feedback, I would really appreciate it, and it will help me on my next presentation. Thank you.
Thank you.
Thank you.